And here we are, as we are here. That's the title of my talk today. This is Anna Marie Askin-Evans from Center for Holistic Psychotherapy. We wanted to reach out to offer our support like so many people are doing as we as a community, nation, and globe work together to try to stand apart. And what I mean by that is the social distancing, the way our societies and communities have had to adjust to the coronavirus. So we're in challenging times. Some people even say we're in an unprecedented time. Yet we must remember that we are resilient people. We're descendants from our ancestors that overcame hardship, adversity, and we're wired for resilience. So one of the things I want to talk about is that how can we remind ourselves of that, and how can we tap in to our own resilient nature? So I thought we would talk about that, and here's some thoughts on that. So we now know that each state, each jurisdiction is dealing with their own cases of the coronavirus. And so there's different mandates or policies that we have to abide by. And so we have to say to ourselves, okay, this is here. So we're going to have to focus on what is it that's in my power to control. What is something that I can do to control, manage, and empower myself to get through this time? So I've got to decide how I'm going to control my energy and my efforts, and how with that I'm going to keep what I call a can-do positive mindset. What I'm going to have to learn to do is think about what I'm for. Am I following the advice of the CDC? Am I doing my part to make sure that I am working for a solution? We want to make sure that we're going into this with the idea that part of being resilient is finding a new way, is overcoming and not looking at so much what has happened in the past, but from this day forward, what is it that we're doing in order to combat and to find solutions? So one of the things we have to do is stay away from the blame game. Blame keeps us in a victim mentality. It almost paralyzes us emotionally. We can't go back and change what was, what wasn't. Sure, there'll be plenty of time to go back and look to see what lessons needed to be learned, and we should always learn from the past. But what we want to do too is we want to focus on what we can do now. I can, I will. This gives us an incentive to move forward, to find solutions. So we want to find ways of what can I do to help improve? What can I do to help mitigate this particular situation? So what I also tell my clients is that we have an innate value to create value in our lives. So how can I create value in my present environment? How can I reach out to others? How can I still follow the CDC's advice and social distancing, but still have acts of kindness, acts of productivity, and even doing mindfulness and helping others, staying calm and compassionate? I call that the other C words. The other thing that helps to build resilience is take control of our day. So how do I structure my day, especially when I have work obligations, I have children, some of us are homeschooling. So we have to strike a balance between what needs to be done and how I can be creative and learn something or try something new. This includes a balance of how much of the news cycle I'm going to take in. I'm going to focus on the facts and not speculation, along with limiting our social media exposure as well. And I always say, add some humor to your day. You want to focus on appreciation, whether it's something like a book or something man-made that might be created, your favorite song, a movie, a television show, going out in nature. We can always find something to appreciate in nature. If you can't go out, you can look out your window. You can see what's there. If you live in a city, I always say, take a mini mental vacation. I tell people all the time I go to Hawaii and Tahiti on a weekly basis when sometimes I need to regroup and remind myself of my strength. I just take a little mini vacation, take a picture out of one of my favorite spots. I know that might sound silly, but try it. It helps us stay focused on, what we can control. The other thing too is each of us can reach out. We have the technology, whether it's phone, through Skype, there's different formats like Zoom that we can reach out to our loved ones, we can reach out to our neighbors, we can reach out to our co-workers as well. Find ways to be physical. Walking, if you can get outside, as long as you're practicing social distance. YouTube and other streaming venues have exercise programs or classes that you can take. I'm making sure I go up and down the stairs quite a bit. Also breathing. Breathing helps to calm down our nervous system as well. And even any type of artwork, even if you're doodling, painting, or just coloring outside the lines, it helps us to just lower our nervous system enough to just see that we can manage this. Another thing that we want to think about is what are some of our connections in terms of our spirituality. And that doesn't mean it has to be, if you're faith-based, that's great, but it could be something that you realize that you believe in, a belief system, something that brings you that sense of awe. That helps us too to realize there's a much bigger picture out there too. So those are some things that we can do. Now the other thing that doesn't go unnoticed is that most of us are going to be going through some difficult times, whether it's a loss of job, a postponement of a wedding or graduations. So we have to find ways of supporting each other and finding a support network. If you're having financial issues, reach out to those financial institutions that maybe can help you. If there are utility bills, that you can work out something with those companies along with your employer too. That's going to be really important. If you're feeling like medically that you need some things answered, you can reach out to your medical health provider, and they are doing a lot of telemedicine. And I am going to really encourage you that if you're having difficulty processing this emotionally, to reach out to your mental health professionals. There are all kinds of resources in your community. Most communities will have a community service board that can help direct you to a mental health professional. PsychologyToday.com has that as well, or even your Chamber of Commerce can look up resources for you as well. So we want you to not feel like you're alone in this, that you can reach out. There are neighbors, there are people that are caring and compassionate, that are willing to help. So if your life situation is such, whether it's an environment, maybe there's health issues, maybe it's just that you're single and you're on your own too, reach out to us, because we want to make sure that you feel supported in any way that you can. So reach out to your local resources. So getting back to what does work, what we can do, we want to balance responsibility with productivity, with creativity. Find time to find those good stories. Look to those that are inspirational as well. And while we're moving through this, I want to give you some advice that I tell my clients that when I work with them that are going through a hard time. Think of 5 positives in your day, 5 positives about yourself, 5 positives about your life. 5 positives helps us to start to create a more positive neural pathway, helps us start to override the negativity. Then I have them couple that with gratitude. What are some things that I can look around and be grateful for? And when we do this, we start to build that neural pathway that reminds us that we can create good out of a challenging situation, that we are resilient, that we can do this. And from this day forward, this is a path that we can take. So please take care. Please heed the CDC's advice for social distancing, and please reach out. We'll be coming to you more frequently in the coming days. Thank you.